Hey, sweet mamas, welcome back to my channel. So, today, let's talk about something that's just so important to me: how to advocate for your baby in the hospital without feeling pressured. How many of us have had those moments, right? So, my goal here in today's video is to empower moms to stand firm in your decisions, say no with confidence if you feel like the words no need to be said, and understand your rights in a hospital setting. So, let's do this, okay? Here we go. If you're about to give birth, you might think that everything doctors recommend is mandatory, but that's not the case. You have rights and you get to make the decisions for your baby. Okay, so here's a disclaimer because I want to make sure we get all this very clear in what I'm speaking here. I am not a medical professional. I am just a mom with years of experience. I have 4 children that only one is a child still living in my home. All of them are grown adults and most of them are married. And I have 4 grandkids of my own now. So I have years of experience to back up what I'm sharing with you and life's lessons that have been learned a lot the hard way. So I come with you from that mama heart who has learned a lot through the years of experience and dive me into research, asking those hard questions and being able to come to you now talking about these kind of hard topics, but they need to be spoke about. And I'm glad so many of us and so many more people are waking up and speaking about these hard topics. My goal is to help you feel informed and confident in the choices that you have in front of you so you can make the best decisions for your family and your baby in this circumstance. So, unfortunately, many moms walk into hospitals feeling like they have no say in the process. But I want you to know you do have a say. And today I'm going to walk you through exactly how to stand firm, what you can decline, and how to respond when the pressure starts. Okay? This is what I wish I had for me back in the day when I was a young mom starting out. And so I'm here to provide it to you today. Well, the hospital setting is designed to follow protocols, but those protocols aren't always in the best interest of maybe ourselves or even our babies. They're really based on liability and efficiency and sorry, my nose itches, and what's standard, not what's necessarily right for each individual patient, right? They have to have policies in place, obviously. So, but they do have pressure tactics. And I have been, almost all of these have been said to me. And some of them have been said to my adult children now that have since had babies. Some of them have been said to me while I'm in the hospital with my adult children while they're having my grandbabies. So here we go. This is just standard procedure. You need to do this for your baby's safety. If you refuse this, then you're putting your baby at risk. If you don't agree, we might have to involve social services. Yes, that was actually said to me. The truth, none of these things mean you have to comply. None of them. You always have the right to ask questions and decline. Please, mama, hear my heart. You always have the right to decline. Is that ever precious vitamin K shot? This is often given automatically at birth. I'm going to give you some ideas. Okay, so for researching, I would start with Dr. Sherry Tenpenny. She's out of Ohio. She is known for her decades upon decades of research on vaccine safety and newborn interventions. Okay, she is a amazing resource. If you like watching documentaries, any of the Vax documentaries, Del Bigtree is in those. He is also interviewed Sherry Tenpenny. There are so many medical doctors that I'll be adding to this list, but I don't want to overwhelm you, so I'm going to tell you start there, okay? And those share about medical interventions for babies. So vitamin K drops. Some moms have even opted to who have chosen the oral vitamin K as an alternative. So at the end of the day, this is your decision. I cannot stress that enough. As a parent, it is your decision. Research, pray about it, and do what's best for you and your family and you and your baby. Another vaccine right when the baby's born is hepatitis B. Originally, this vaccine, y'all, was only recommended for babies who were born to mothers who were actually hepatitis B positive or considered high risk. So, such as like IV drug use was used or exposure to infected blood. However, unfortunately, it later became a routine recommendation for all newborns. I would say unfortunately, but that's my opinion, regardless of the mother's Hep B status. So this is another area what I would encourage you to do your research and ask the questions. One of the questions I would say is, if you test negative for hepatitis B, why would your newborn need a vaccine for a disease that's primarily spread through blood to blood contact? That's just a question you can ask yourself. Okay. Erythromycin eye ointment. Now, this was only meant to prevent infections from STDs. So if you do not have an STD, why does your baby need it? Another question to ask yourself. Um, Immediate cord clamping. That was something I never even considered when I was having babies. I consider it now. I'm out of the baby making years, right? But I still consider it now because of the research that I have found out about it. And I'll go do a deep dive into that later. But delaying it has major benefits. Look them up. Yet most hospitals will still rush to clamp that cord. So if you want them to delay that, that's not a big deal. And it's not a big request. Just have them delay it 10 to 20 minutes, and please look that up, like research that. Routine bathing. Guys, this was something that never even crossed my mind when my babies were younger. After researching it, I wish I had known, which is why I'm doing this now. Did you know that babies are born with a protective coating, that white coating, that vernix? That's that creamy white substance. It is full of amazing goldness, like awesomeness. I'm not even kidding. It's natural antibacterial properties. It helps protect your baby's skin and their immune system. Routine hospital baths wash away that vernix too soon. It removing those precious benefits that your baby is getting from them. So early bathing can also cause a drop in the baby's body temperature. It interferes with when they take the baby away too soon, that could interfere with your breastfeeding and bonding time and process. So many moms now just choose to delay baby's bath, or just do a gentle wipe down instead if you want to keep that vernix intact. And just make sure you tell the hospital staff up front that that's what you want to do. I have noticed more and more, from what I'm learning now, more and more doctors are in tune with that, and nurses are totally will let you do that. They're not going to push for that bath. Saying no at the doctor's office or hospital, like I said, it can be intimidating. I remember those days, but this is your baby. No one has more authority over their care than you do. So here are some phrases to help you stand firm with love, right? So when they say this is just standard protocol, please feel free to say, I understand it's routine, but I've done my research and I am choosing to decline this intervention for my baby. Okay. So when they say, maybe this is required for your baby's safety, this is required. Okay. Can you show me the medical necessity for my specific baby? I need to see all the risk and benefits before I make that decision. Okay. It's okay to ask for that. When they say, you'll need to sign a refusal form. Okay, that's fine. I would like to read it thoroughly before signing it, but feel free to bring it in, right? Keep your responses short and confident. Okay, just short and confident. You don't need to explain yourself. Just hold your ground. This is your baby. You have legal rights in the hospital that many staff, they just won't tell you about, a lot of them, because a lot of people don't ask, right? Informed consent is the law. They just provide full disclosure they must provide full disclosure before any intervention. They must do that. You have the right to refuse any treatment, even if they try to pressure you. So don't buy that. You can request an alternative provider if for some reason you feel like that nurse or that doctor is not respecting your wishes or answering your questions. You have the right to ask for someone else to come into the room. You have a right to fire them if you are feeling bullied or pressured for any reason. You can definitely ask for another nurse or another doctor. So know that. And they cannot take your baby away for refusing treatments. Hospitals use scare tactics, but you have legal rights. And I can say that, and that sounds like they use scare tactics, but they use them on me, guys. I am not talking about something that hasn't happened to me or someone I know personally. So if you ever feel intimidated, please know that you can ask to speak to a patient advocate or a hospital administrator. That usually will shut all this right down. Okay, so you have that right too. You mamas, here we go. Let's just say this. Let's just end it right here. You are your baby's first advocate. The hospital has its policies, but at the end of the day, like I've shared before, the doctors go home and you get to live with the choices you made that day. So, if you're preparing for birth and want community of moms who get this, right? Who've been where you are, who support each other in making informed choices, feel free to join us over my Holistic Mom and Bear community.